Well, ladies and gentlemen, I'm putting all on mute and we begin. Now, yesterday, last lecture, that is, I believe, on Saturday, the 31st, we spoke about the generalities of Merc, and I told you Merc is a human barometer and a human thermometer. Because Merc is basically a very sensitive metal. So it's a liquid metal, but it's very sensitive to the atmospheric changes and the temperature changes. So that's what we saw. That means it shows that Merc is sensitive to both extremes of temperature and atmosphere. बहुत टेम्परेचर बोले तो बहुत गर्मी भी इसको पसंद नहीं है और बहुत ठंडी भी चलती नहीं है. In fact, Merc is having internal chill. There is a particular chill as a creeping chill. It is known as creeping chill. जैसे कि किसी ने आपके बदन पे बर्फ घुमा लिया हो. अगर किसी ने बर्फ आपकी पीठ पर अगर किसी ने बर्फ घुमा लिया, तो what type of creeping chill what you have? So the same feeling you have in Merc. So Merc, whenever Merc is suffering, so he has this typical creeping chills. And on the other side, he is highly sensitive to the heat of the bed. So heat of the bed bhi nahi chalti and chill bhi nahi chalta. So that's why I said it is having both extremes. Merc is having both extremes. Either it is we cannot tolerate too hot or too cold. He needs a very temperate climate, and he's comfortable in that. Secondly, that sudden change of altitudes is also not accepted in Merc. If there is a sudden change of altitude, he may have gastric problem and he may suffer from dysentery. They say more the blood, Sol is indicated, more the mucus, core is indicated. So both are having dysenteries. Merc core, the severity of Merc core is more than the Merc Sol. Because when we say more the mucus core is indicated, that means mucus coming out, more mucus coming out with tenesmus. It shows that there is a lot of destruction of the tissue. The catarrhal tissue is getting destructed in this. More the blood, Sol is indicated, more the mucus, core is indicated. Now remember these words because both are excellent remedies for dysentery. Because if you go to foreign countries, there is a lot of foreigners, they suffer from irritable bowel syndrome more than Indians. Even in India, I have seen hardly very few patients I have seen with irritable bowel syndrome. But if you go to foreign countries, they have got a card with their photograph and a photograph printed on the card, and it is written "Can't wait." It is written "Can't wait." Can't wait. Bole to you can go and show the card to any family, any house, and they'll open the toilet for him because he cannot control it. And here, why I'm telling you this story is here we can think of Merc Sol or Merc Core because the tenesmus is so severe that it is during, so it is before, during, and after stools. There's an unfinished sensation before, during, and after stools, the tenesmus on both all these two remedies. Whereas we talk about when we talk about Merc or Merc Sol is slightly milder in form than Merc Core. Core is corrosive. It is more corrosive. The more the mucus core is indicated, more the blood Sol is indicated. More the blood, Merc Sol is indicated, more the mucus, Merc Core is indicated. You remember these words and we can go further down. So as I told you, it is highly sensitive. We have to remember 5-6 cardinal symptoms of Merc. First is aggression from sunset to sunrise. रात को whenever till Ravi is there, आपके मन में बुरी बातें नहीं आती. Ravi बोले तो सूर्य. As far as the sun is there, you will always have Shuddha Vichar. But the moment it is night, you will have all the destructive plans. When night, रात को ही डकैती होती है, रात को ही खून खराबा ज्यादा होता है. So it is more in the night time. So here, and bad thoughts also, after 8 o'clock, you start thinking about enjoying yourself in some other way. So all these things, they happen in the night after the sunset. So from sunset to sunrise, Merck's aggravation is there. Second, aggravation by the heat of the bed. Third, aggravation by extremes of temperature or extremes of uh, altitude change. Fourth, generalized emaciation. Generalized emaciation. You will find weight loss. Generalized emaciation. पूर्ण बॉडीचंच वजन कमी व्हायला लागतंय. It is not like Natramur or like podium where the upper body is emaciated and lower body is semi-dropsical. No, there is a generalized emaciation. Fifth, sixth, generalized trembling. That means there's directly the action is on the nerves. The nerves are getting damaged and there's a destructive change. The nerves are getting distracted. Then we have generalized offensiveness. My God, all breath is offensive and discharges are offensive. The sweat is offensive. Fetid, they call it fetid sweat. I call it offensive sweat because all the symptoms you have generalized offensiveness. Then one more very important factor is generalized sweating, profuse sweating, which the symptoms are not relieved by sweating. In fact, they become worse. They become worse. So sweating normally during fever, for example, if there's a sweat, that means the fever is getting relieved. But here, sweating will worsen the symptoms and generalize profuse sweating. So all these symptoms, when we pile them up together, we come across Merc Sol, or Merc Solubilus. Why? Why is it so important for us to go to all these general symptoms? Because these symptoms, and one more thing is, there is generalized ulceration. It might be on the skin, it might be in the mouth, it might be inside the nose, any mucous membrane. So ulceration is also generalized. And another important factor is there is a generalized, whenever there is a discharge, it is thick, yellowish green, thick, offensive discharge, the pustular discharge, the pus. So many, I mean, 7, 8 symptoms or 9 symptoms. When you pile them up together, we come across Merc. So when we talk about Merc, basically Merc or any of this syphilitic remedies, they are always hurried. They are always hurried and worried. They are always hurried and worried. Whereas they, if you talk about argentum nitricum, Merc is there, of course, acid nitricum, these are all syphilitic remedies, and they're always hurried and worried. So hurried, always, they want to do everything in a hurry. Second thing, they have got a destructive tendency. Either they'll destruct themselves or they'll destruct someone else. So that is suicidal and homicidal, which comes from the same center in the brain. Comes from the same center in the brain. So generalize, you have, uh, generalize destructiveness when there's destruction either himself or others. So here they say the highest form uh, in the known world, we are not talking about Ravan or any other person like the villains of Mahabharata and Ramayana. We are talking about the known world. The worst syphilitic person they say was Hitler. Now, why Hitler? Because of Hitler was responsible for the Second World War, and during the Second World War, 5 crore people lost their lives. It is not a small amount, my dear friends. 5 crore people, one person responsible for the death or a destruction of 5 crore people. Not only that, the women were not spared. The last 10 days of Berlin, there's a book on last 10 days of Berlin where all the Allied forces were around Berlin and Hitler was giving guns to boys of 13, 14-year-old boys. He said, "Oh, we will be victorious. Don't worry. Take the gun. Go and fight at the border." And the boys were so much motivated by this gentleman. this Hitler, Adolf Hitler, they used to take the gun and they used to be very proud that yes, Germany is going to win. And what happened, my dear friends? There, in the last 10 days of Berlin, when the Allied forces, like there's a French army, the British army, the Russian army, the probably the Indian army too, and then all these countries, um, the American army, all these countries had surrounded Berlin because they wanted to catch Hitler, and 80,000 women were raped from the age of 3 to the age of 70. Out of this 80,000 women, 30,000 women got pregnant, out of which 20,000 women they got themselves aborted. My dear friends, it is multiple rapes, 10 days of raping going on, and it is a horrible thing. And these are the autocracies of war. And what one person, because of one person, what can happen? It's the story here, and well, I will never justify this, whatever has happened. But the highest form of syphilitic tendency, or syphilitic miasm, was in Hitler, and because of Hitler, 5 crore people lost their lives, and so many women they had to lose their, morality. So that's not done basically. It's a very bad thing. So why I'm insisting on this is you should know what is a syphilitic miasm or the king of syphilis is Merck. Then that means you should know the severity of the king of syphilis. The Merck has got destructive tendency, and probably one of the remedies or one of the constitutional remedies for Hitler could have been Merck, because if Merck was given to him, probably his tendencies of destructiveness would have come down. Let's consider this. So here, what I'm telling you is, as I told you, here the headache, headache cannot, whenever there's a headache, especially at night, as I told you, from sunset to sunrise, fever, headache, body ache, all these things, pain in the ulcers, everything is worse in the night, and headache, especially worse in the night, cannot cannot touch, cannot be touched also, because of the head, it can be so severe paining. And there's, as I told you, there's a creeping chilliness, which is a peculiar complaint of Merc Sol. As I'm repeating it as if I say, बर्फ अगर आपकी पीठ पर घुमा लिया, किसी ने आपकी पीठ पर ऐसा बर्फ घुमा लिया, so what that creeping chillness is, you will realize that. Then when we come down, one of the one incident in my life was when I was working with Dr. Jugal Kishore in Delhi. I was staying in Lajpat Nagar number 3. Now, Lajpat Nagar is an area where all the 6 Punjabis, when they fled from the Pakistani Punjab and came down to Delhi as refugees, Lajpat Nagar was given to them as to stay. And today, Lajpat Nagar is full of Punjabis, Sikhs and Punjabis. So I was staying as a paying guest there. And then to improve my knowledge of homeopathy, I used to have a kit of 50 homeopathic remedies. So regularly like Naxomika, Arnica, Bryunia, Aconite, Belladonna, and so on. So I used to carry these 50 remedies, and whenever someone wanted some homeopathy, I used to give it. Now, why I'm telling you this is, that's the way I think I could learn from my mistakes, what I was doing right and what I was doing wrong. Because I used to work the whole day with Dr. Jugal Kishore, and evening I used to come to Rajpat Nagar. So evening, someone used to come to my doorsteps and to my room and used to ask me for some medicine. And yes, I used to readily give it. So why I'm telling you this is, one fine night around 10 o'clock when Sardaji woke me up, his wife had come and she told me that her husband was having severe pain in the eyes, and she had brought the husband. So I went to see the Sadaji. The Sadaji had come to my room. So when I saw the eyes were bloodshot red, and they were so red as if I couldn't look into the eyes, and there was severe lacrimation, and eyelids. The eyelids also were red, as if ulcered, and the pain was so severe that he was shedding his eyes always because he couldn't look at the light. So I said, what does he do? She said he has got a fabrication unit. So fabrication बोले तो जो welding चलती है. So welding. So welding, I said fine. So and today he had to do some extra work. And Sadaj is a hard working. You all know very well because anywhere in the world you go, you will find Sadajis there because of their hard working nature. So this Sadaji was also a hard-working person, and well, his eyes were, I mean, जो बोलते हैं ना मराठी में आग ओकत होते डोळे आग ओकत होते. So severe, I mean, basically as if the fire is coming out of the eye. So because I thought that because of the exertion and all that, I gave him Arnica 200. But next day again he came back and he said that well the pain was slightly less because of arnica because arnica is a pain reliever, but the redness was the same and the lacrimation also was the same and it was burning. The eyes were burning. So when I went to the clinic, I spoke to the boss, Dr. Jugal Kishore. Sir, I said ऐसा हुआ है क्या करें? He said किताब में दिया है पढ़ो. As I told you, these old nuts are very hard to crack. They normally don't tell you immediately the symptom. So I said, fine. So I went to the book. I went to the book and I just couldn't find it because then he said that eyes में inflammation पड़ा क्या? I was looking at the pain. Inflammation पड़ा क्या? So I said नहीं, inflammation पड़ा. So when I read the topic of inflammation, it is clearly given inflammation of the eyes due to glare of light. Now, what is glare of light? Glare of light is जो welding का glare है ना. This glare itself, it can be. I mean, uh, that glare is very bad for the naked eyes. That's why whenever you have a look at the uh, solar eclipse, you always take a solar goggle or dark something dark like a welding glass, and you look through it because you are not supposed to look at the sun uh, during when it is bright. Same with the solar eclipse, you are not supposed to look at it. So here, this gentleman was working fabrication unit, बोले तो that is a glare of light. And evening I gave him Merc Sol 200, and next day he was all absolutely normal. So why I'm telling you this is a glare of light. You know, you will find. Tell me, उसमें क्या बड़ी बात है? Glare of light वाले हमारे पास कौन आने वाला है? I said now again. Second patient where I treated was whenever people go from Kolhapur to the high altitude for as mountaineers, I always give them a bottle of Merc Sol 200 because it's normally an acute thing. First is whenever they go to high altitude, they may have high altitude dysentery, and the only alternative, if you don't have Merc Sol, if the only alternative is descending from 25,000 feet or 21,000 feet, you have to come down below 10,000 feet. And and when the dysentery is on, look, host may be, if you are having, if the troops are very less and war is going on, and if you have fever, आपके हाथ में बंदूक थाम देते हैं. But if you have loose motions, वो बोलेंगे सो जाओ, पीछे जाके सो जाओ, because you can't even lift the gun. So how can you bring a person with altitude dysentery down 10,000 feet? So Merc Sol, I always give them Merc Sol, one of the remedies. And of course, coca is there for the high oxygen absorption. Whenever the oxygen level drops, coca is normal oxygen absorption. And Merc Sol is also given for whenever you go on in the Himalayas. The one of the worst uh, dangers is looking at the snow because snow can reflect sunlight. There's a glare of light from the snow, and if you don't have proper glasses, dark glasses, you can have inflammation eyelids, eyes, and you can go into blindness, my dear friends. I have treated one mountaineer who, because of Merc Sol, he was saved, or he had become totally blind because while doing his load series, he was carrying his load on his back to the upper camps, and while coming back, he fell down and he broke his glasses because he was not carrying spare glasses. And those days there's no plastic glasses. It used to be glass. I mean, glass glasses. So the glasses broke, and then still he walked down to the camp. And by the time he had reached the camp, because he had realized that he was just trying to shade his eyes while walking down, but the glare of light from the snow was directly hitting his eyes while coming down. And here he went into blindness when he entered a tent, went into blindness. But the camp leader was having Merc Sol. So when he gave him Merc Sol, this person he had those days he telephoned me saying that, sir, अगर आपकी दवाई नहीं होती तो I would have realized what a tragedy a blind man feels. A blind person, what he must be feeling whenever he can't see. So here, because of the glare of light, he had lost his vision. So here, Merc is one of the greatest remedies, only remedy, as it is aggravated after glare of light. Then nose, there's a pain in the septum of the nose, or the person, because of the ulceration in the nose, a person can lose his septum. Now, who loses his septum? Normally, these professional boxers, they bring out their septum. They septum nikal dete. Because even if they get a punch on the nose, that pain is not that agonizing. The septum ये निकाल they just surgically remove it. But मर्क वो surgically निकाल सकता है, no, or not surgically निकाल सकता है, because the ulcers and discharge, yellowish green thick offensive discharge which comes out of the nose. The Merc is one of the remedies for this yellowish green discharge which comes out of the nose. So here again, why I'm telling you this is, uh, we have a couple of cases where the people have lost their septum because of the discharges of the from the nose. Then mouth. Now mouth is one of the ear. We have otitis media, pain in the ears with thick yellowish green discharge, and which is offensive and worse at night. The pains are always worse at night. The pain in the ear is worse at night, and there can be a destruction of the tympanic membrane with a lot of, loss of hearing or impaired hearing, and continuously very offensive discharge from the ears. The mouth has got very bad breath. अगर वो क्लोजअप की मुस्कान आपने एडवर्टाइजमेंट देखी होगी, मगर क्लोजअप कैन ओनली गिव यू अ टेम्पररी रिलीफ, whereas the breath, the bad breath in the mouth, one of the main reasons is the gums. When the gums are infected, spongy gums, Merc is having spongy gums. Whenever you press the gum, you will find blood coming out, or the gums, the edges of the gums are reddish and very spongy. And because of the spongy gums, the teeth become loose. The teeth become loose. Now, because of the spongy gums, if the teeth are becoming loose, what I was supposed to eat? अगर दांत नहीं तो खाएंगे क्या? And this gums, because there's a lot of infection in the gums, pus in the gums, and offensive breath, and the saliva is slimy saliva, that is sticky saliva, especially salivation. Continuous salivation is there because of the infection in the gums. There's a continuous salivation with the spongy tongue. The tongue also becomes very heavy and spongy, thick, spongy tongue with imprints of teeth. दांत के उस पर इम्प्रेशन आ जाता है टंग पर. सो टंग दातावर असे दाता जिभेवर असे दाताचे वन उठतात. That is imprints of the teeth on the tongue with spongy tongue, excessive salivation. Now, here there is a contradictory symptom. Excessive salivation with great thirst. Excessive salivation with no thirst is ipecac. Excessive salivation, great thirst is Merc. And dry mouth without thirst is pulsatilla. Now look here. See, there are some contradictory symptoms, and you have to catch the right essence of the remedy. To catch the right essence of the remedy, you've got to know this typical symptoms or peculiar complaints of each remedy. So there is excessive salivation, slimy salivation, metallic taste in the mouth. Now, metallic, you must have realized what is a metallic taste, because हम जब बच्चे होते थे तो मुंह में कभी-कभी पैसा रख देते थे मुंह में. तो पैसा रखने के बाद जो टेस्ट आता है, whenever you keep a coin in the mouth and the taste what you develop in the mouth is metallic taste. So Merc is having a metallic taste in the mouth, and that metallic taste will give rise, I mean, to typical, I mean, the excessive salivation in the mouth, thick salivation, and whenever he sleeps, he salivates during night. They like Barata carb again. Barata carb because he cannot hold the salivation. Merc because there's excessive salivation, the mouth can't hold it. There's a constant, either you have to swallow it or either you have to spit it, or when you lie down, you can see the drooling of saliva during sleep. So we are continuing Merc on Saturday because we cannot finish it now. And if you have any questions, you are free to ask. I am opening up the galleries. Yes, please.
Good afternoon, sir.
Good afternoon.
So, difference between pulsatilla, greenish yellow mucus, and Merc Sol discharge, greenish yellow often.
That's right. Nice question, Sonal. You have to remember pulsatilla is gland. Pulsatilla varan bhat hai. Merc tamla rasa hai. Cut hai.
More right. Okay.
Offensive.
Okay.
Merc is offensive. Pulsatilla is bland.
ओके सर, बहुत बार पेशेंट लोग बोलते हैं कि बच्चे जब सुबह उठते तब इनके मुंह में से बहुत बदबू आती है.
वो टिपिकल मर्क है. रात में एक्यूलेशन ड्यूरिंग नाइट.
Okay, so sometimes children they don't clean their tongue properly. Because of that also sometimes the bad breath is the reason.
और कुत्ता किधर ब्रश करता है? Does a dog brush?
Okay.
It doesn't.
No. No.
No?
So in such cases, even we can think of the Merc Sol.
Why not?
Merc or
because see, even if you rinse your mouth without any toothpaste is again a temporary phenomenon. Only with the tongue.
Correct.
You rinse your mouth only with the tongue, and you'll find that the teeth can be clean. जो earlier जमाने में गुजराती लोग वो कोई काढ़ी खाते थे. Some
दातुन.
हाँ, वही. Something Gujaratis were very fond of that. So where was the toothpaste that time? The toothpaste was that time. But their teeth used to be very clean. Their breath used to be very fine. कोई problem नहीं.
Correct. Many moms they complain कि बच्चा सुबह उठता है बहुत मुंह में से बास आती है, बहुत मुंह में से बास आती है.
That's right. Then we have to think of Merc.
Okay. Thank you, sir.
Thank you. Dr. Pranav is waiting to shoot some questions. He is looking at me.
No, sir. No, I am enjoying, sir. I am enjoying. Really wonderful.
Enjoying. Shall we close the lecture?
Yes, sir. No more questions.
Any questions?
Sir, next will be tomorrow.
Hello.
Tomorrow, no, I think I try to go on Saturday because I'm taking it as per the timetable of the college. College का timetable है ना, इसके हिसाब से.
हाँ. Okay, sir.
I can't overlap someone else's timetable.
Yeah, sir. See your convenience, sir.
Huh?
See your convenience and then you take the classes. No worry.
Because
Yes.
I am an employee of the college. I am your friend, fine. But मेरे कॉलेज का ड्यूटीज मुझे निभाना पड़ेगा.
Yes, sir.
Yes, sir.
Dr. Mugdha, you want to ask me something?
No, sir. Understood. Nice lecture.
Thank you. Very nice.
Hello.
Dr. Sakshi Talwar.
Hello.
Shall we close the lecture?
Yes,
Sir,
sir.
I wanted to ask.
Yeah,
Sir, can you hear me?
I can hear you. Why not?
Sir, can you hear me?
I am hearing you,
Yes.
Dr. Sonal.
Sir, I wanted to work in the skin cuts.
Haji? क्या बोल रहे हैं?
Room condition. full of smoke in
नहीं, आवाज क्लियर नहीं है आपका, म्यूजिक आ रहा है, आवाज क्लियर कीजिए।
हाँ, okay, no problem.
हाँ जी,
Next lecture में कुछ
कुछ सुनना और किसी को सुनाई दे रहा है?
नहीं,
No, sir. Her voice is disturbed. Let her type it out. Type it out and ask you.
हाँ, she can always call me on my mobile. I'll speak to her. कोई प्रॉब्लम नहीं। I'm free. I'm a free bird.
hello, sir.
Yes.
Sir, I wanted to ask the skin problems. Can you please explain the skin problems of the Merc Sol?
Merc Sol, the skin is always worse in the night. Then it is having multiple ulcers on the skin with lardaceous base. Lardaceous base is when the base is yellow. It looks like there's a lot of pus. The background, pustular background, and the edges are irregular. It is not like calibi. Calibi is punched out ulcers. The Merc Sol is irregular edges. And smelling. The smell is offensive. Without offensive smell, Merc Sol can be contraindicated.
Okay, sir. So, should we think if any itching is there in the night, so there should be some rawness also in that?
See, you have to work. I mean, you have to see that is it reaching of the psoriatic miasm or the syphilitic. Syphilitic is destruction. There has to be
Yes, sir.
pus. There has to be ulcers. Destruction of the
Yes,
teeth
sir.
has to be there. Psora is
Right, sir.
only eruption.
Right, sir. Right, sir. Got it, sir. Thank you, sir.
So, sir, please can you tell me the some of the medicine for pyorrhea of the mouth?
Pyorrhea.
Hello, जी sir.
Pyorrhea क्या होता है?
Common medicine pyorrhea वही दांत से खून निकलता है, बदबू आती है दांत की।
See, if you have the oral hygiene, problems of oral hygiene, the Merck group is there. Then whenever there is whenever there are cracks on the tongue and ulcers in the mouth, then Merck of course is there, but then we have to think of acid nitricum. Acid nitricum is also a very offensive remedy. When there is a gastric origin and bad smell, then Baptisia is one of the remedies where they say enteric fever. It's the king of enteric fever. Enteric bole to the entron is the large intestine where the seat of problem is there. So whenever there is a problem including the intestine, there has to be a bad smell, isn't it? Yeah. Then because of stomach upset, excessive eating, drinking, then we can think of nuts.
And staphysagria, sir, staphysagria. Sometimes it works well, sir. Staphysagria.
Staphysagria.
ब्लीडिंग जब होती है तो अक्सर बिना सोचे कभी दे देते हैं स्टेफिसैग्रिया, तो अच्छा हो जाता है, बट स्टेफिसैग्रिया का क्या मींस क्या
If you're talking about after the tooth, I mean removal of the tooth or something like that, there has to is the surgical intervention is there?
No, nothing.
Nothing.
As it is.
ऐसे स्टेफिसैग्रिया काम करेगा without any
हाँ,
reason.
कई बार मैं पल्स स्टेफिसैग्रिया देती हूँ तो कई लोगों का ठीक हो जाता है ऐसे।
रीजन तो चाहिए ना आपको, अगर स्टेफिसैग्रिया आपको प्रिस्क्राइब करना है, इज इट मोटिवेशन, इंडिग्नेशन है, मेंटल्स में सर्जिकल प्रॉब्लम है और एक्सेसिव आई मीन बैड इफेक्ट्स ऑफ मास्टरबेशन है, देयर इज कपल ऑफ रीजंस इन स्टेफिसैग्रिया,
then only cure will be there, no?
We have to have some reason. See, there is nothing called blind prescription in homeopathy. Find out a reason, and yes, I'll agree. If you give me a reason, I'll certainly agree with you.
अच्छा, okay sir.
बराबर बोला क्या?
Sir, which remedy is king of?
बिल्कुल सर, हाँ
हाँ,
हाँ, यस सर, बिल्कुल सही।
okay.
इसलिए तो होम्योपैथी को कोई जल्दी नहीं सीख पाता है एलोपैथी की तरह कॉमन नहीं है।
आप जब तक आप मेरी बातें सुनते रहेंगे, आप सीख जाएंगे। I make it very simple.
Yes,
Yes,
no
sir.
doubt. No doubt in that.
और देखो
Sir,
Sir,
one more, sir.
डॉक्टर प्रणव वाघानी बैठा है, देखो उधर, वो मेरा स्टूडेंट है.
Sir, can you
Sir,
please differentiate between the aphtha and mouth ulcer of the Merc Sol and the nitric acid, sir?
Nitric acid is having, Merc Sol is having
Lardaceous
Salivation.
base. Merc Sol lardaceous base. Nitric acid raw flesh. Base is looks like a raw flesh.
Okay, sir.
and one more thing, nitric acid is having cracks on the tongue, whereas Merc is having flabby tongue.
Okay. So only if aphthas are present and there is no cracks on the tongue. So anything related to salivation
If you
and
punch out, then I'll think of Salivation.
okay, only
पंच राउंड 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 रहेगा ना, तो कालीबाई सोचूंगा. If only redness is there, then borax सोचूंगा.
Okay, sir. Got it, sir. Thank you, sir.
अरे देखो, मुझे हेल्प करने के लिए मेरा स्टूडेंट बैठा है प्रणव.
Sir, which remedy you told for king of enteric fever, Nagswamika?
No, baptisia.
Okay, okay.
Okay, bye.
Okay, thank you, sir.
सर
हाँ,
ये सब बेसिक में ही प्रॉब्लम है और ये सब बेसिक में ही सब लोग इधर उधर अटक जाते हैं सर. ये तो अच्छा है, वी मेट यू इन कॉलेज डेज एंड वी आर थ्रू विद दैट. अदरवाइज ये मुंबई में तो सब ऐसे ही सब मॉडर्न सब होम्योपैथ है. ऐसे ही सब चल रहा है सर. अभी किंग ऑफ,
अगर देखो, they want to learn, so why not teach them? इसमें क्या बड़ी बात है?
यही तो बात है सर. इसलिए आप मुंबई में आए हो सर, एक लेक्चर रखो सर.
अरे क्या है, मेरी मुंबई वालों को क्या कंपेयर करते हो मुझे? मैं तो थर्ड क्लास हूँ यार, छोटे गांव का हूँ.
नहीं
Nice, so great. Don't say like that.
So you are teaching the basics, sir.
Basics. I believe in basics, and basics ही
Yes,
पढ़ाना
sir.
पड़ेगा.
Because वहीं पे ज्यादा अटकते हैं, sir.
Okay, बंद करूँ?
Okay, sir. Thank you so much.
Sir. Thank you so much, sir.
Have a nice day. Have a nice day.
So we'll continue in Merc Sol.
Okay, sir.
Okay, sir.